Good morning or good afternoon, everyone here attending. I appreciate you taking time from your busy schedules. My name is Dr. Chudley Wirch, and I'm CEO and founder at Prevention Plus Wellness, located here in beautiful St. Augustine, Florida, beautiful and historic. And we've got 1 hour to be with you together. I hope you have the time because we've got a webinar that's chock full of information. You can see the topic today: data-driven substance use prevention plus wellness program implementation. I had presented this earlier in the year, but have made substantial changes to it, corrections and additions. And so even if you have seen this earlier, I think you're gonna get a lot of good content out of this. Of course, this deals with prevention, program evaluation and monitoring generally, but also very much specifically associated with any of you using or perhaps in the future to be using prevention plus wellness programs for youth or parents or our media campaigns. So lots of good information here. So we're recording this, and I'll be sending everyone who's registered for the session a link to the recorded webinar. I'll send everyone the slides, and everyone will also get a certificate for 1 hour CEU for those of you that are viewing today's session. Okay, so again, thanks for joining us. Let's go ahead and take a look, dive right in, and let's take a look at the, take a look at the objectives for today. There's 4 of them. So you will be able to identify purposes for monitoring and evaluating substance use prevention programs generally. And then secondly, you'll be able to describe the data collection tools and the measures that we use here to assess prevention plus wellness programs. Those are the youth programs, the parent programs, and the media campaigns. Thirdly, you'll be able to examine evaluation designs for determining both risk and protective factors and health behavior change effects to prevention plus wellness programs or from PPW programs. And then lastly, that blue block on the bottom of this slide, they're going to explore how to compare pre and post survey results, as well as some examples of case studies of outcomes from prevention plus wellness programs. So we're going to cover all of that and more today. So if you have any questions at any time throughout this whole webinar, please don't hesitate to go to your Q&A and to type it in. And then at the end of today's session, if we have some time, and I'm sure we'll have some time, I'll take those questions and comments in the order that they're received. So if you have anything that pops up in your mind, something that's not clear, something you want to express, this is your period, your hour, go ahead and use it. We want to hear from you as prevention and health specialists from across the nation and abroad. Love to hear your comments and your thoughts and your suggestions. So Q&A is where you provide that on your screen, on your control tab, which is on the top of my screen, at least, your control bar. All right, so that's what we're going to be covering. I think one more time, I'll just restate it. You will be receiving these slides. You will be receiving a link to the recorded webinar. You'll be receiving a certificate for 1 hour CEU. Before we launch into all of the content, let me pull up a poll, which I think will help us to understand a little bit more about who's online today, and your interests, your background, perhaps a little bit. So perhaps I can tailor the webinar a little bit. So I just launched the poll. It'll take just a moment to get to you. It's 4 questions, and just let it have a chance. I think all 4 questions you could actually answer multiple items too, so you can have more than one response to these 4 items. And of course, if you're just listening in, you don't have the option to respond to the poll, which I apologize 4. So there we go. Finally, it's a little bit slow today. It seems like the system's a little slow. I saw Ronald had his hand up. Let me see. If you have any questions or comments, Ronald, or anyone else, you can just go to the Q&A and just point at that and type in what you need. So 4 questions. You're starting to receive them. People are starting to complete them. We got 30% of you have completed the 4 questions. So I'm just going to give you a couple more minutes to let everybody who wants to participate and can answer these 4 questions. They're related to the topic of evaluation and monitoring prevention programs, but from your perspective, it's what you need, what you like, what you want to see. And so it'll be very instructive for all of us, but me especially. So we've got 36% of you have responded. So I'm going to wait a little bit longer. I want to make sure everybody's had a chance to respond. We're up to 40%. That's great. I really appreciate you taking the time to answer these questions so we can hear from you and get your perspective on what you want to hear today and what you need in the future for your prevention programs with regard to evaluation. So we got half of you have responded. We'll just give another minute to see if we want to have some more of that. We're over half now, almost up to 60%. That's fantastic. Over 60% have responded, 65%. So the majority of you have responded. Maybe another 30 seconds. So see if we can get even more of you have to respond to the 4 poll questions. So we're up to 68%. That's awesome. That's an amazing response rate for any survey or poll. So 68% of you have participated in today's poll. I'm going to just wait another little bit more time to see if we can get that up to 70%. See if we can get a 7 out of 10 of you to respond to these questions. We're almost there. 67% have responded. And last chance, 70%. Woohoo! We reached it. Yes, with your participation, we've reached 7%, 70%, 7 out of 10 of you. And now then it went back down to 68. So now it's back down to 66. So I think maybe more people are entering online. And so I'm gonna shut it off at this point. And I'm going to share those results with you. So they'll just take a moment to get to you. And there's 4 questions. You can answer multiple items. And so I'll read the responses with you as they come back to you so you can see them as well. Number 1, what are you most interested in? Helps to read carefully. Why are you most interested in prevention program evaluation? That was the first question. And most of you said to provide data for decisions about implementation. So that's over half of you responded that way. So that's really, really important, very, very critical to have that data so that you can make decisions about implementation, quality, where you're going. And that sort of ties into the other highly responded items: collect feedback to promote your program, assess your program outcomes, and track the quality and fidelity of your program. And then on the very end, some of you do have mandated requirements for your grant, but that came way after these other items. Provide data so that you know how to implement your program, how well you're implementing it, what the outcomes are, how high the quality and fidelity is. All very, very critical reasons for program evaluation, regardless of what kind of program. But of course, we're talking about substance use prevention programs here. Question 2, what types of data collection measures are you most interested in for your prevention programs? And the number 1 item was outcome. In other words, what are the results? Those could be risk and protective factors. Those could be actual substance use or other health behaviors. So that's number 1. And then that's followed by process and quality. That's, of course, precedes outcomes. Actually, if you have high quality implementation, if you have fidelity, which follows that. Those really help to promote and increase the probability or likelihood of having positive outcomes. But you responded first, outcomes. That's what you want to see, and I understand that completely. And then you had, you're interested in numbers. You're interested in quantitative data, and that's important as well. So you want quantitative data, you want outcomes, and you want the process or quality of implementation. Great answers. Number 3, how do you prefer to analyze your prevention program data? And you say comparisons of before and after. You want to see what's changed before the program and after the program that makes sense. And that's followed by summary statistics and even some case studies and statistical data. But by far, number 1 is you want to compare pre-post data. So, and we'll be giving you some examples of that. By the way, we'll be giving you examples of all of these things that I'm asking you today. And last question, number 4, how often would you like to see your results? Most of you said quarterly. I think that's an interesting response, and that's a good amount of time. And that's followed by, I think, annually, monthly, immediately. But actually immediately is a little bit higher. A third of you said immediate results. I think that would really be fascinating to be able to do that. More effort and energy to do that. That's a possibility, but quarterly certainly is the case. And so we could talk about all those things. I'm most interested in this last item because I just added that at the last minute and want to start thinking about how we at Prevention Plus Wellness can start providing you with more current or more frequent results on your programs, and or at least, or perhaps as an option, train you so that you can look at those data. But I'm interested in all of these, and we'll be addressing all of these things in our webinar today. So I'm going to stop sharing that. Thank you once again for participating. Let's start the discussion with purposes for monitoring and evaluating prevention programs. I came up with these 7. 5 of them were listed in your first polling question. And here they are here. These were some that I could come up with very quickly. You may have some others. Let me just see what the, okay. I wanted to check that Q&A real quick. And yeah, some of you will not be able to answer the poll questions. I apologize for that, because you may have called in, etc. So anyway, these 7 items are reasons for evaluation. From number 1, tracking the quality, fidelity of the program implementation. If your program is not implemented with quality and as it was meant to be implemented, even if it is evidence-based, even if there is research supporting it, it's going to be less likely to have positive outcomes for you. Number 2, you want to assess your program outcomes. I think that was the main interest for the majority of you. Of course, you want to know how effective, what's the efficaciousness of your program? Are you achieving what you want to achieve? And then that leads to number 3, data from which you can make decisions about implementing your program and improving it over time, as well as number 4, to promote your program, to promote it back to your youth, to your parents, to your organization, your community, and ultimately even back to your funders to sustain your program over time. You may not have thought of number 6, but certainly collecting data can contribute to research in the evidence-based in the prevention field. And then lastly, I added this at the last moment because I know this is a reality for some of you, but not many of you responded to this, that you're mandated to collect evaluation data by your funding agency. Okay. And by the way, that ends up being a bit of a conflict sometimes as far as we're concerned, because we offer at Prevention Plus Wellness built-in evaluation tools. Funding agency may have other requirements and needs. So sometimes those come in conflict, and we work with our providers to make sure that, you know, there's some continuity and some collaboration with regard to that to the extent possible. Let's take a look at PPW, that's Prevention Plus Wellness Program Data Collection Tools and Measures. There's 5 key ones I want to highlight to you. First of all, if you have a prevention plus wellness program, a youth program, any of our youth programs, sport, in shape, marijuana, all of these are PPW, by the way, marijuana prevention plus wellness, opioid prevention plus wellness, our vaping program, almost all of our programs, if not all of our programs, I don't know, really have a built-in risk and protective factor pre-test and post-test. It's designed to be efficient. It's designed to provide you with the data you need to determine outcomes and to give you the data to promote and to improve your program. So risk and protective factors are measured because you can implement this survey immediately before your lesson, your program, your PPW lesson, and immediately after your lesson, because many PPW programs are a single session. You can do all that within that one period, whether it's 45 minutes, 50 minutes, 60 minutes. So you implement your pre-test survey, launch your program and complete it, and implement your post-test survey. And because of that, you can't measure behavior change, but you can measure risk and protective factors. We'll talk more about what those are in a minute. Secondly, we do provide a pre and post health behavior survey. This includes measures of risk and protective factors plus actual health behaviors. So both of these surveys measure outcomes. They measure the effectiveness, if you will, of your program. A third tool we offer is the instructor survey. That assesses the quality, or it's a process measure, if you will, a quality of your implementation with your youth or young adults in your setting. We also have number 4 fidelity checklists to ensure that you implement our evidence-based and evidence-informed programs the way they were meant to be implemented to increase the probability of seeing outcomes. And then lastly, for our parent training program, we have a parent training survey, a post-training survey, which measures outcomes. So those are the key tools that you receive. There are some others, but those are the key ones you'll receive to assess, as you can see, outcomes and quality and fidelity of your prevention plus wellness program, whether it's for youth, whether it's for parents, whether it's the media campaign. Let's take a look at the pre-test and post-test surveys, the immediate risk and protective factor survey. So with the prevention plus wellness programs, you get 2 versions of the survey. You can have an online version, or you can have a paper version. And the most recent version, we just updated it this year, is a 3.0. If you're using an older version, let us know. We'll get you this newer one, because we do change them over time. And so there's some differences, obviously, between an online and a paper survey. We'll cover that today. The immediate risk and protective factor survey includes 5 risk protective factor measures, 5 substance use measures. So notice that we're measuring multiple substances: alcohol, tobacco, e-cigarettes, marijuana, opioids generally, and are the ones that are generally included. And so we're casting a broad net for measuring risk and protective factors associated with multiple substances. And we do that because we found, even though our programs like sport, which addresses largely alcohol, we found through research that it has impacts on other substances, not just alcohol, but tobacco and marijuana, for example. So that's why we cast a broader net in our measures of risk and protective factors and risk and protective factors for multiple substances. And on top of that, we're measuring risk and protective factors for healthy behaviors, including physical activity, 2 measures of nutrition, including breakfast and fruits and vegetable consumption, sleep, stress control, and health goal setting. All of these things are, all of these healthy behaviors, if you look at the flip side, are chronic disease risk factors that are very, very common among US and other Western adolescents, Western nation adolescents. So, for example, most youth do not eat breakfast every day. Most youth do not get an hour of physical activity every day. Most youth are not getting 8 or more hours of sleep, et cetera. So these are requirements. These are identified as as needed health goals, and they're not being achieved and reached by most adolescents. So that's the uniqueness, I think, of prevention plus wellness programs. They integrate these healthy behaviors with and promote the healthy behaviors with the prevention of substance use. Post-test survey. The post-test survey of this risk and protective factor measure also includes 2 qualitative items. So the previous items measures are quantitative, they're numbers. The 2 qualitative items allow you to have a mixed data collection an approach, mixed methods approach. So you get qualitative and quantitative data. So you get, they help inform each other. You get the data, the hard data, the number data, the quantitative data, and then you get the qualitative data that helps inform and better understand the quantitative data. What does it take? How much time does it take to fill out these surveys? This risk and protective factor survey takes about 5 minutes to do the pre-test, takes about 7 minutes to do the post-test. They're not very long. Post-test is longer because it has those 2 qualitative items. Okay, makes sense. If you have any questions, let me know. I will address them at the end of today's session. What are the exact measures, the specific measures on the risk and protective factor pre-post survey or immediate pre-post survey? These are the demographic measures. You can see those. By the way, school and location would let you look at specific locations or schools or instructors if you want to look at data at that level. Code number if you want to match up pre and post. Again, you don't have to do that. But these are some of the others as well. Now, here are the actual risk and protective factors. One of the risk and protective factors is called behavioral intentions. Behavioral intentions are the most predictive measure that we know of scientifically for assessing future behavior. It's called behavioral intentions. So you've got 5 substance use behavioral intention measures. Those are risk factors. We've got 6 healthy behavior intention measures. Those are protective factors. These items are all measured on a 5-point scale of very likely to very unlikely. And there's 2 examples on the bottom there. And the next year, how likely are you to get physical activity most days a week? That's a behavioral intention item of a healthy behavior. The one below it is a behavioral intention measure of substance use, specifically drinking alcohol. Next year, how likely are you to take a drink of alcohol? And again, those are measured on a 5-point scale, very likely to very unlikely. And we'll talk about assessment of those in just a moment. A perceived harmfulness is another risk factor measure on your pre-post survey. And a very common measure, we do know that it has been collected for years and years, monitoring the future annual data. We do know from that national survey and others that as youth perceive a substance as being harmful, they're less likely to use it, and vice versa. So we want to promote perceptions of harmfulness of substances, specific substances. So your survey measures 5 substance behaviors, 5-point scale, a great deal to not at all. And there's one example of this perceived harmfulness, sometimes called perceived susceptibility, perceived risk. They're all the same thing, and when we're talking about it. But if you were to use marijuana often, how would it harm your health or healthy habits? And they, again, youth respond on a 5-point scale, a great deal to not at all. And because PPW programs address substances as being harmful to health, to wellness, to productivity, to self-image, to these other healthy behaviors, we do see very often that that there's an increase from the beginning of the lesson to the end of the lesson of perceptions of harmfulness of multiple substances. Other risk and protective factors that are included now with the 3.0 version of the risk and protective factor survey is a likelihood of feeling sad or hopeless. It's a mental health measure. We've seen this in national surveys where it's gone from 30% to 60 or more percent of youth reporting sadness or hopelessness, so much so that it interferes with their daily activities. So very much a serious, an important and a serious indicator of mental health problems or issues among our young people. So we've included a version of that in the risk and protective factor measures. How much control do your friends have on your substance use, or a measure of influence from others? And we've measured this in the past in our research of our PPW programs, and we've seen that PPW programs can increase protection. In other words, that their friends are less likely to influence their substance use. That's why we're including it now. How happy are you with your current mental and physical health? Sort of a self-assessment of overall wellness. And then 2 sort of marketing measures that are still very important reactions from young people. How much did you like the Prevention Plus Wellness program or lesson? How much will it help you to avoid substance use and increase your healthy habits? So those are the other risk and protective factor measures. The qualitative measures on the post-test are these. What did you like best about this lesson? For example, how does it affect your health, behavior, substance use, motivation, goal setting, self-esteem? And then the other open-ended qualitative item, what did you like least about your lesson or your program? For example, what do you think should be changed or improved? And when it comes to these 2 qualitative items, let me just say that the first one, what did you like best, can be used as really, statements or testimonials, brief testimonials to promote your program. You could share those with others to say, hey, look at, and by the way, I think it'll make you as a prevention provider feel very good about yourself and your program, because you'll see the kinds of outcomes you're having, reducing, you'll hear testimonials of kids saying, hey, it helped me prevent substance use or reduce my substance use or increase my nutrition or my breakfast eating or my sleep, or it motivated me or it helped me set goals. All outstanding things for you as a prevention provider to hear, which you may not have ever heard of, even in a long career, because you may not be measuring these risk and protective factors immediately before and after your program implementation. Secondly, the second block down there, what did you like least? That data, even equally important, because it's going to identify potential problems that you can make some corrections to and improve upon the next time you implement your program. So if you check these data on a quarterly basis, at the end of the first quarter, you can maybe make some tweaks to your program implementation and improve upon it the second quarter. Okay, does that make sense? Let me know if you have any questions about that. Qualitative measures, really, really important to have qualitative measures in addition to quantitative data in any kind of outcome measure. All right, now let's take a look at pre-test, post-test health behavior survey. So in addition to the risk and protective factor survey, which is an immediate pre-post survey, we also have an optional health behavior survey. This health behavior survey includes not just the pre and post, not just the risk and protective factor measures, but as the name implies, also health behavior measures. So these are the demographic measures. By the way, because this is a little bit longer survey, it takes 10 minutes to complete it. Here are the 30-day behavior measures. So you're measuring, in addition to those risk and protective factor measures, moderate physical, over the last 30 days, the level of, the amount of, the frequency of, the quantity of moderate as well as vigorous physical activity, eating breakfast, eating fruits and vegetables, sleep hours, setting fitness goals, alcohol, tobacco, e-cigarette, cannabis, opioids, and meth use, and feeling sad and hopeless. So those are 30-day behavior measures. So what that means is that this survey, the health behavior survey, the post-test has to be implemented at least 30 days after they've received the program, the Prevention Plus Wellness program, because you're measuring back 30 days. So You implement your pre-test before your PPW program, you launch your PPW program, and then you collect your post-test. If you're using this health behavior survey post-test, you collect it at least 4 weeks after the implementation of your program. It could be longer, 2 weeks, did I say weeks? 4 weeks, I should say, or 1 month later. It could be 2 months later, 3 months later, 6 months later, 12, a year later. It's up to you, or multiple post-tests if you want to, but it has to be at least a month later because it's measuring backwards 30 days. I hope that makes sense. And the risk and protective factor measures in the health behavior survey are the same as those in the risk and protective factor survey. Now, what are the desired directions? What do you want to see as a prevention specialist with these measures of risk and protective factors and behaviors? Well, let's start out on top. Substance use risk factors. You want to see the risk factors go down. You want to see them decrease, or at least stay level. So you have really two options there. Preferred if they go down, but let's say your measure, there's two examples there. Example, substance use behavioral intentions should decrease. In other words, a use intention to use alcohol in the future should go down. But let's say at pre-test, your group already is at like 95% intentions to not use alcohol. There's no room left for improving because 95% have already said they're not intending to use alcohol. There's not a lot of room for improvement from pre-test to post-test. So that's one of the issues with these risk factors. So, and if you're dealing with younger kids, let's say a 6th grader or a 5th grader, risk level is quite low with regard to behavioral intentions. There's not going to be many youth intending to use, let's say, cannabis as an adult or in the next year. So there's no room. That's why I'm saying as long as it stays the same in that particular case. When you get to older adolescents, however, there's greater risk and there's more room to see actual change in behavioral intentions of substance use. Now, perceived harmfulness is a little bit different because there's more, we see in the data, there's more room for improvement. In other words, even for younger kids, they're not all thinking, for example, for alcohol, they're not all thinking that alcohol is the most harmful thing in the world. So there's room to increase harmfulness over time. In terms of protective factors, behavioral intentions, for the healthy behaviors, you want to see those increase. Now, you're much more likely to see these increases because there's quite a bit of room for improvement with regard to, in the future, will I get regular physical activity? Will I eat a healthy breakfast? Will I eat fruits and vegetables every day? Will I get 8 hours of sleep? Will I set goals? There's more room for improvement at the pre-test, so you're likely to see increases in behavioral intentions at the post-test because not just because there's room, but because also your prevention plus wellness program promotes those healthy behaviors. If you're using that actual health behavior survey, you're going to want to see decreases, or at least no increases in substance use behavior, and you want to see increases in the healthy behaviors. Okay, that's what you're looking for from pre to post, and most of you said you're interested in comparing pre and post. Let's take a look at the instructors survey. This is a process measure. It's a measure of the quality of your implementation of your PPW lesson or your program. You've got 7 key indicators or measures. They're all assessed on a 5-point scale of a great deal to none at all. You can see what they are. Your level of comfort in presenting the program, you want that to be high, a great deal. Active presentation strategies, good eye contact, voice fluctuation, etc. You want that to be high. All of these you want to be high. Level of enthusiasm, your level of enthusiasm, very important, because you are implementing, as a prevention plus wellness program implementer, a motivational intervention. You want to motivate your youth to consider and to begin to change their behaviors, to improve their health habits, and to avoid substance use. So that's why enthusiasm is very important, especially when you present to a group versus an individual youth, for example. Number 4, level of smoothness or continuousness of your lesson. You can see some of these will improve over time with practice or with implementation, like comfort level number 1, smoothness number 4, accuracy of following your protocol. All PPW programs come with a scripted protocol. If you follow the protocol, you could assess yourself very high on this scale. Number 6, complete the whole program. We want everybody to implement all 3 elements, components of the screening and brief intervention PPW programs within one period. So that means screening health habits, feedback using PowerPoint slides, and goal setting. All those 3 elements should be implemented in one period. That's why it says implement your lesson completely. And then lastly is a participant response. Were they responsive? Were they, did they see like they're engaged in your lesson? So 5-point scale. And then if you want, there's some additional measures. You could identify which program, because we have so many different programs, you could identify, and you may have in your organization some implementing sport, high school, some middle school, some opioid adolescents, et cetera, parent programs, whatever the case may be. So you can identify which program, how is it implemented? And that's because you can implement most PPW programs to youth individually or in a group, in person or online. We even have one video-based program, and we're coming out with another that's can be implemented online completely. So that's sort of an expansion of some options for implementation. And then lastly, what did you like best and least as the implementer? So if you collect this, and by the way, this should be collected at the end of every lesson, here's what you're going to be able to learn. You're going to be able to, and you should be able to, in terms of what you're looking for your data, you want to be able to reach and to maintain the highest score on those 7 items, those first 7 items. In other words, you want to score yourself a great deal. This, by the way, this is self-implemented, so you're scoring yourself. Although if you have a manager or supervisor, they can observe you and score you and provide you that kind of external feedback. But otherwise, you score yourself on these 7 items, and you want to be at the highest level possible across your implementation. In other words, at the very beginning, you want to hit high on all 7 of those items. In other words, you want to rate yourself high on comfort, high on active presentation strategies, high on enthusiasm from the first time you started implementing your PPW program to the midpoint to the latter point. And realize, as a social human endeavor, prevention programs differ over time. You feel differently. You may feel good one day, poor the next day. The youth population may be different. The setting may be different. And all those variables can influence, to a certain extent, your quality of your implementation. So that's why it's essential for you to be a bit of a scientist, an observer, a data collector of your own behavior. And that is these 7 items, these measures of your quality of implementation over time, because you want to start with high quality, starting with the practice phase, all the way through your entire program implementation. That's why it's essential for you as the implementer, the teacher, the instructor, the coach, a student, if a student's implementing these programs to their peers, to assess themselves and to maintain high level quality implementation over time. Okay. Fidelity is the last, I think, or next to last measure I wanted to tell you. The fidelity checklist assesses pre-implementation, implementation, post-implementation steps. You can see them here. Pre-implementation, for example, did you get trained before you implemented the program? Did you practice it? Did you implement your pre-test? Implementation steps include, are you following your script? Do you have high enthusiasm when you present your lesson? Are you implementing all of your lesson in one setting? Are you using your slides, your PowerPoint slides? Are you reading the goal plan and having you sign it and you co-sign it? Those are implementation steps, some of them. These are just some samples. I think there are a total of 12 or 14 implementation fidelity steps. Post-implementation, are you collecting post-test survey, instructor survey, fidelity checklist, et cetera. So what are you looking for in terms of your fidelity checklist? The greater the number of items checked off, the greater the level of fidelity. So it's not a either or, it's a continuum of fidelity. Again, I said there's 12 or 14 items. If you had all of them checked off, you couldn't get any better than that. So, but they're yes and no checkoffs for each of these items. Fidelity can be assessed and should be assessed early on in program implementation, and then maybe at a midpoint and later point. If you want to, every month, you could check fidelity to make sure you and your organization, your implementers are providing your program as it's meant to be implemented. The last measure I wanted to talk about is the parent training survey. This is a post-training survey. If you're implementing one of the PPW parent programs, this is an online survey. So these are the questions that parents will be asked. How much did they like the training? Was it helpful? And then two really important measures: confidence. Are they confident to provide the PPW messages to youth at home? Are they confident to ask their youth to complete a goal plan? And what's the likelihood of them doing those two things, providing those positive prevention plus wellness messages and goal planning at home? And then, of course, the qualitative items, what did they as parents like the best and the least? And that can really inform you as to how well your parent prevention plus wellness program training is going. You want to reach and maintain the highest level scores from all parents that are participating in your training across time and across setting. And the two qualitative item measures, what do they like best and least, can be used to, again, to promote the parent training program and to improve it over time. How often should you collect and monitor your program data? Now, some of you said quarterly was your preference. Some of you said immediately. Some of you said, annually, but here's what we recommend. In terms of pre and post-test surveys, every youth or every young adult, every participant should be giving a pre and a post-test. And we recommend monitoring those on a monthly basis or a semester basis or an annual basis. Maybe we'll change our mind. Maybe we'll change that to quarterly, and we could see if we can help you get those quarterly data, or maybe even help you get data every time you implement your program. Instructor survey: every time you implement your PPW lesson to youth or to youth, you should monitor it. You should collect it should be done immediately after your instructor survey. You assess yourself using that instructor survey, and you could monitor the quality of your program implementation using that instructor survey on a monthly basis. Keep an eye on it. Make sure you're scoring high in all those 7 items. Fidelity checklist, we recommend every month. Parent training, you want to collect your parent surveys, evaluation surveys for all parents at the end of every training. And again, monthly, semesterly, yearly, or maybe quarterly would be the best thing to assess. If you have a question, please just type it in at this point, the Q&A, and we'll get to that in a minute. Let's take a look at evaluation designs. We got quite a bit more content here, so I'm going to keep pushing ahead. In terms of designs, in terms of how you implement your evaluation is important. And it depends on the types of questions you want to have answered and the quality. But typically speaking, if you're using the immediate pre-post survey, the risk and protective factor survey, typically what happens is you'll use the minimum design there, where a 0 is a survey and an X is your PPW program. So 0 is a pre-test, X implement your program, 0 is your post-test. That's the minimum design. The beauty of the immediate pre-post survey, the risk and protective factor survey, is we've designed it so that you can collect it, the pre and the post, immediately before and immediately after the lesson. So you can do it all within one setting. So you don't have to follow up with youth afterwards. A better design is listed below, where you've got one group of youth given a pre-test and the PPW program and a post-test, and another group of youth that's similar, given a pre-test and a post-test, but no program. So that becomes your comparison group. And so that becomes a stronger design because you're able to compare a group that gets the program with a group that doesn't get a program. Now, that comparison group, that could be a group of youth getting any other program. It could be a health program, or it could be PE, it could be social studies, or it could be a period of physical activity. It doesn't matter, but you have this comparison. By the way, we're always available to consult with you on your evaluation designs if you're interested in improving the quality of your designs and your data. How about designs to assess health behavior? So if you're going to be using the health behavior survey, remember, you have a pre-test, and then your post-test has to be at least a month after the program. So your minimum design is 0, that's your pre-test, X, that's your PPW program, and then notice there's a gap there, which means there's a month or 2 months or 3 months or whatever, and then your post-test. Remember, you have to have a gap of at least a month after your lesson, because your health behavior survey, if you choose to use the health behavior survey, measures backwards 30 days, measures health behaviors and substance use behaviors 30 days. A better design, look below that, is where you have a comparison group. So if you use the health behavior survey, what you're going to have to do with it, the advantage is obvious. I think you have measured not just risk and protective factors, but you also you're also measuring health behaviors and substance use behaviors. But the challenge to it is you have to follow up with all those youth at least a month later to collect your post-test. So you have to go back into that classroom or whatever the case might be. Okay, those are a couple of designs. In terms of your surveys, you've got 2 options of your pre-post surveys. You've got a paper version and you've got an online version. Look at the left-hand column. There's some real important advantages to the online. No data handling, huge advantage in terms of time and effort. Probably increases the quality of the implementation because youth will feel more confident, answer less socially desirable answers, more accurate answers, because they know that it's more confidential, quick and easy. The downside to the online survey versus the paper survey is it does require some kind of a device and Wi-Fi. So it's probably more likely, as we've found throughout the country and abroad, that the online survey is going to be used in settings where the youth have access to a Chromebook or a laptop or a cell phone, and you could show them the link or the QR code. They could click on it, enter their pre-test, you present your lesson, you show them the post-test link or QR code, and they can complete that. So that's there's some real advantages to the online versus the paper survey. If you're collecting your data using the online survey, it's very simple. As I just said, you show your customized code. By the way, if you're using our programs, you can ask me anytime, info@preventionpluswellness.com, and we'll send you a customized link and a customized QR code. So, and you could add that to your youth Chromebook, so you could display the QR code. They could point their cameras at it and open it up and do the pre-test. But we'll send you a customized just for your organization, so your data is separate from everybody else's. So, and you just request it from us at Prevention Plus Wellness. It's a free service, and so you display the pre-test link or QR code That's displayed, and then you do the same with the post-test. If you're using the health behavior survey a link or QR code, of course, you're going to have to come back a month later. And then you just request this at any time for your data, and we'll send you that data. It's in a SurveyMonkey format, so you get charts. We'll send you the raw data. It's yours. You can do anything you want with it. If you're collecting paper surveys, what you need to do is, you hand out your pre-test survey and your post-test survey to your individual youth or your classrooms of youth. You have them do the pre-test. Try not to be near them so that they don't feel that you or somebody else is looking to help improve the quality of it. But they do the pre-test, you present your lesson, they do the post-test, and then you go to each youth and ask them for the pre-test and post-test, and put the pre-test on top of the post-test, and then just put them in a box or an envelope. And when you're ready, we'll send you a template, an online template, and you can hand enter the data. And then you have access to the charts and the raw data. Okay, but you have to obviously hand enter the data. So you have to collect the pre-test and post-test, put one on top of the other, so they're physically connected. And then we'll send you the online template, and you hand enter the data. We can hand enter it for you, but because it takes time, we do charge for that. Let's take a look at comparing pre and post survey data. You're interested in looking at that, so let's take a look. Here's what we do oftentimes. Here's an example of a behavioral intention to get more sleep. So the question was number 3: in the next year, how likely are you to get 8 more hours of sleep? The pre-test is on the left and the post-test is on the right. So we can physically put them together so you can compare them. So you could see at pre-test, 36% of youth said they're very likely to get 8 or more hours of sleep. At post-test, after the lesson, it went up to 42%. And if you look to the far right, the difference is 6%. There's a 6.17% increase in very likely to get 8 or more hours of sleep. Now, you can decide what you want. Normally, we have a cutoff of, like, say, 5%. Anything 5% and above will highlight that because of the error and the chance and so on in these data. So there's one example of how you can compare pre and post actual percentages and responses, number of responses. Here's another example, pre-post comparison, behavioral intention to drink alcohol. Now here, we see it went, we looked at both, we added very likely and likely. So the question is, next year, how likely are you to drink alcohol? Very likely and unlikely. And you can see those numbers went down. Very likely went from 13% to 12%. Likely went from 14% to 8%. Add those up, the total is about 6+% increase in, that should be actually a decrease in the likelihood of them drinking in the future. That's behavioral intentions. That's really important. That should be a decrease. You could look at the other end of the scale, by the way. You could look at, unlikely and very unlikely. So it really doesn't matter. You have a lot of flexibility in what you're highlighting. It's the same side, it's the other side of the coin, but it's the same thing you'll see. So sometimes you can, if they're in the same direction, we can combine the very likely or very unlikely, or the unlikely and very unlikely, if they're in the same direction from pre to post. Here's one last example of perceived alcohol use harm. That's that risk factor, alcohol use harm. It was question 11. If I drank alcohol regularly, would it hurt my health or healthy habits? Pre-test is on the left, post-test is on the right. We found that movement in the agree answer only, positive movement, where 16% said they agreed if they drank, it would harm their health at pre-test, and that went up from 16% to 24%. That was about why do I have 3% difference? That's quite a bit more than that, isn't it? Yeah, that's like for like an 8% difference. So I don't know, there's an error there. So double check your math so that you know the difference there. Okay. So by the way, there's a lot of things you could look at here. So it does help to have somebody who's data oriented. For example, look below there, I highlighted in green skipping. Sometimes, and by the way, this is not matched data at this point. It's not the same person matched. It's two independent surveys. And so what we see, and sometimes we see more people missing at post-test follow-up for whatever reason. So if that ends up being a large number, let's say you had 2% missing the pre-test, but you had 2 people missing pre-test, but you had 20 people missing post-test, that can influence your results. So you got to take that into consideration. But this is just an example. And then here's some case study examples. And I'm going to send this to you and I'll let you look at this. So this is a case study of implementation of sport in a group setting, 114 people in New York, masked middle school version. And you could see how we did the case study: 7% increase in intentions to get physical activity, 14% increase in intentions to get mostly healthy foods, 18% increase in getting more sleep, 11% increase in stress management, and then 12% less intentions to drink alcohol, 9% less intentions to use marijuana, etc. Even the bottom one there, 11 to 13% increase in percentages of thinking that none or all of their peers would use substances. So it all depends on the survey. And then equally important, here are just some cutting and pasting of what did they like best. I liked how it got me to motivate to play more sports and eat breakfast. I liked how the connection between drugs and health and drugs harm your health. I liked how it makes people aware of what their health habits do for them and gives them recommendations on how to change it. So these are the qualitative items, and they help understand and better promote your program. And don't remember, there's also what did they like least, which that's for internal use within your organization, how you can improve your program. So there's a number of case studies here you can look at. In conclusion, very important things. Number one, lots of good reasons to evaluate and to monitor your program. Number two, Prevention Plus Wellness has both online and paper surveys for both immediate assessment of pre-post risk and protective factors, as well as longer-term health behavior. The preferred online surveys have a lot of advantages over paper surveys. And lastly, look at the bottom, monitoring data to ensure high quality implementation and comparing your pre-post survey. Really important for you to make good data-driven decisions about promoting your program and improving it. We offer free customized links for our online surveys. We'll send you the data, we'll send you the charts. We do charge if you want us to write evaluation reports or to have consultations. And then if you want to look at how some of these data looked, if you haven't looked at SurveyMonkey, this is the kind of things you get. You get the charts and you also get the frequencies and percentages. So you get really good data. All right, let me pause at this point and see what the Q&A shows, see if what kinds of questions that were asked. I'm seeing a lot of instances, Ross says, where stimulants are not included in studies, but stimulants have a high rate of co-occurrence. Is there an issue with trying to quantify the use of stimulants? So good question, Roz. The question is, where do you stop with measurement, and what kinds of stimulants do you want to measure, and how much time do you have to collect your measurements? So there's so many things in the epidemiology is constantly changing, but here's what hasn't changed in quite a while. We know that the number one substance of use and abuse for young people is alcohol, followed by e-cigarettes, followed by marijuana. After that, you can measure anything you want. We've added tobacco because of its frequency, as well as opioids because of the focus on that nationally. In our health behavior study, we added methamphetamines, but you can tailor these surveys to measure other things, stimulants, certain kinds of stimulants, other things you want to, but but realize that that's going to increase, or unless you take something out, it's going to increase the time for your data collection. And if you want to collect it within your pre-post survey, within your lesson, you got to keep that in mind. You got to be cognizant of that. And you got to put it into perspective too, Raj. You got to say how many people are using stimulants as compared to how many people are using other substances. So, but it depends on what your needs are, what the needs of your organization is and your community and your young people. So definitely I agree, adding measures, additional measures of stimulant risk and protective factors and stimulant use may be something you need and decide to do. Next question, hopefully I answered that for you, Roz. Next question, thank you for a wonderful presentation. Can you have access to the PowerPoint slides and recording? Yes, I'll send that to everybody. Any other questions? Last chance to ask a question or make a comment. Again, everybody's going to get the slides, going to get the link to this recording. There's so much data here, so much stuff to look at. Please share it with others in your region, your state, your nation. And if we can help you, if you do use any of Prevention Plus Wellness programs, please consider us a consult, a free consultation to help you with your evaluation design. We're always interested in learning how our programs are performing for, settings and populations, throughout the country and throughout the world. So always happy to help any way we can. I don't see any other questions, so I'm going to say thank you guys. God bless you for all you do, for making a difference in the lives of youth and families in your communities, for doing the important work, the hard work, the essential work of preventing substance use and promoting healthy lifestyles among young people. You're awesome. You're heroes. You're prevention heroes. It's an honor and a blessing for me to interact with you. And last question, in the pre-post survey, you said that the respondent ID is self-generated. Yeah, that question, if you want to compare your pre and post survey online, then there's a question there and it asks them to generate their own code. You could give them a code if you want, every youth a different code, but there's a question that says, I can't remember how it goes. It asks them 3 or 4 things and it generates a code. So, what are your last 2 numbers on your phone number? What's the this and that? So anyway, that's how it is. It generates a code. Now, if you're doing the paper and pencil survey and you're collecting the pre-test and putting it on the post-test for every youth, you don't need a code because you're physically connecting them and you're going to enter the data like that for every youth, pre-test and post-test together. But if you want to compare online surveys, pre and post, and a code number can be helpful. But then again, you can just compare the 2 surveys as independent surveys separately and still compare them side by side. So wonderful presentation. I'm seeing, okay, let's see if there's anything else. Thank you. What else? What does it mean? Oh, it just means if you get a code 12XYZ at pre-test, you can match it to the same code at post-test. So you can put those two that's the same individual. So you're putting them side by side, and that allows you to do paired statistical analysis. It's a little stronger. It's a way to use a little bit more powerful statistical analysis if you can match, Jane Doe at pre-test results with Jane Doe at post-test results. That's all the code number is. Okay, does that make sense? I know okay. All right, not a problem. Thanks, guys. Have a great day. Take care of yourselves and others in your region. And hopefully I'll see you at a future date. Reach out to us on preventionpluswellness.com. If you have any questions, if you need any assistance, there we are, preventionpluswellness.com, 904-472-5022. Email us at info@preventionpluswellness.com. We're always here for you. Thanks, guys. Have a good day. Bye-bye.